This conference will now be recorded.
I'm getting better at this.
All right, I'd like to welcome everyone to the Town of Southbridge Special Board of Health meeting, January 7th, 2021. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, GL 30A 18, and the Governor's March 15, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southbridge Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the Town of Southbridge website. For this meeting, members of the public who wish to watch the meeting may do so in the following manner as usual via cable access TV Charter Spectrum 192. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public has can adequately access the proceedings in real time via technological means. In the event that we are unable to do so despite best efforts, we will post on the Town of Southbridge website an audio or video recording, transcript, or other comprehensive records of proceedings as soon as possible after the meetings. I'd like to open this special meeting. It is 5:06 p.m. Agenda item number 2, roll call.
Beth Stevens.
Here.
Roland LaRochelle.
Here.
Tony Postali.
Here.
Caller 5. Nicole Duffy.
Here.
Thank you.
Okay. Agenda item number 3, special meeting agenda item. To hear the petition of the Southbridge Educators Association, SEA, in which they request the Board of Health consider the following. 1, to recommend to the Southbridge School Administration that the schools go forward in a remote learning only module until January 25th, 2021. And 2, to recommend that the Southbridge School Administration offer transparent and uniform reporting on COVID-19 cases. Andy.
I received the petition from actually it was a letter circulated by SEA. The head of SEA asked me to put it before the Board of Health as a petition requesting support. The petition reads, members of the Southbridge Education Association sent a petition to the district state's appointed receiver arguing that Southbridge Public Schools should prepare for fully remote learning after the winter break to slow the spread of COVID-19 in the community and surrounding towns. The petition to receiver, Jeffrey Villar, supports a fully remote learning program through at least January 25th before resuming hybrid or any in-person learning models. The SEA also calls on Villar to ensure that all students have access to the technology necessary to have a successful experience with remote learning. Additionally, the SEA wants the transparent and uniform reporting on COVID-19 cases in the community and assurances that the staff will not be cut at any point during the school year. With a COVID-19 positivity rate that is greater than 100 residents per 1,000 Southbridge, is among the communities in Massachusetts with the highest coronavirus rates, and the number of infections in Southbridge has been consistently climbing for many weeks. Educators wants the district to get ahead of the problems we saw after the Thanksgiving break when COVID-19 infections spiked across the state and in Southbridge, said SEA President Jocelyn Tallis. Tallis said that the lack of free and accessible COVID-19 testing in Southbridge, the only safe way to control the spread of the disease is to limit gatherings, and the schools must play a role in that larger community health initiative. Members of the SEA have consistently expressed concern with the receiver's lack of a transparent and comprehensive plan for teaching during the pandemic. The receiver is acting more in line with Governor Charlie Baker's agenda to force students into in-person learning and is not guiding the district with enough consideration for the public health crisis in the town. Thank you.
Okay. So do we have, I see Dr. Villar. Do we have Jocelyn Tallis here?
We have Miss Jocelyn, we have Dr. Villar, we have Miss Karen Checker of the schools. and we have Miss Margot. Those were the ones I specifically invited. Miss Jocelyn, I invited Miss Jocelyn to represent SEA, and she has indicated to me that she has brought 2 or 3 other presenters, Miss Jocelyn.
Okay, so if that's the case, I don't want this to drag on so all evening. So if there's going to be that many people that wish to speak, it's going to be 5-minute time limit for anybody who wants to speak, because there's just way too many people here. And I know we're all here for the same purpose. You know, we want to do what's right for our school children in our town, but clearly there's a very, very large amount of people here, so we're going to have some limits. So I guess I'll start with Jocelyn.
Hi, this is Jocelyn. I do have a large audience here, but only 3 other people are slated to speak besides myself. Thank you for having this meeting. I'm the president of the SEA, the Southbridge Education Association. I represent all educators, not just myself. We had a petition. We just heard about the letter about the petition. It basically just says that you know, the SEA knows there's no replacement for in-person learning. We all agree that that's the best. However, right now with the amount of COVID cases that are quickly rising and the way it's spreading, we just want to put safety as a priority ahead of in-person. We spent a lot of money being able to buy technology in order to go remote should that time come. And we want to just point that out. What we did as a union is we put out a petition to our staff. And I'm not going to go over the whole thing, but I want to share some of that data. 69% of our educators disagreed or just disagreed to the following statement. The district's guidelines to determine close contact with an individual COVID-19 are sufficient to limit the spread of the virus in my school. 65% of our educators strongly disagreed that students at my school are consistently adhering to a 6-foot social distancing policy. 76% of educators strongly disagreed that the district has clear and transparent health and safety metrics to determine when to transfer to a remote learning model. And lastly, on that part, 71% of our educators strongly agreed with this following statement. Due to the increasing COVID-19 cases in the Southbridge Public School, the district should return to a remote learning model. We did share that with Dr. Villar, and we shared it right before the Christmas break because we knew after what we saw with the Thanksgiving break that it was likely not only to be another uptick, but a very serious uptick because of the longer amount of time off. We want to keep in mind that, you know, some things we are asking for is we want that time off. We want a clear metric of when and how, what the metric is that the district is going to use to close or to go to the remote model. And we also know that the vaccine is coming out soon. And until we get it, we're really not safe. I just want to keep that in mind. So that being said, I want to keep to my time. I'm going to pass this off to Joseph Kepler, who works at the Academy.
Good evening. Good evening, everyone. Thank you for allowing me to speak at this. My name is Joseph Kepler. Again, I teach at the Southbridge Academy. Prior to becoming a teacher, I received a certificate in HVAC repair. At the beginning of school this fall, I asked the district about our HVAC requirements in the middle high school, and they gave them to me. We have filters in place in the middle high school that do seem to adequately filter COVID-19. They have the right size, and they have additional UV lights, which in conjunction with the filter are adequate in my opinion from what I've read. I do have a question about the balance of the airflow, because that is one of ASHRAE's main concerns in COVID mitigation is airflow. If you do not have the proper airflow, you will basically be having air pool in the school, and it won't be filtered as well as it should be, and that can increase the likelihood of transmission. My reason for believing the airflow isn't consistent within the school is that some rooms were often very hot while others were very cold, and that's showing me that the air is not being evenly distributed through the system. There's baffling that needs to be adjusted. And I'm wondering if that was done. I didn't think to ask in the spring or in the fall. So that's a question I have. Additionally, not all the schools have the same HVAC system. The middle high school is very modern. It's a wonderful facility. It's very well maintained. Not all the schools have that modern an HVAC system. Many of our schools are older. I know my school, there's limited airflow. We have air filtration systems in the school, in the classrooms. It's the best we can do. And I mean, I'm more comfortable with it there now than I was at the beginning of the year before we have it. So I'm very grateful for it. But I don't know that it's going to do a whole lot of good if we have 3 kids in the classroom who are infected and spreading it asymptomatically. Additionally, looking at the CDC guidelines, we are, in my opinion, dancing between moderate risk and the higher risk category for COVID transmission. Let me just bring these up real quick. My iPad closed on me. We have hybrid model right now for some students, but we do have students in class every day. And that, I mean, them coming to school every day is increasing their risk. It's increasing the number of people they see. And that is a vector where they can then take COVID-19 home if it comes into the schools. And it has come into the schools. We've had students go home because they have a family member that has tested positive and they came into school anyway. It's happened a couple of times now. And I'm glad that we were able to send them home and we were able to catch it, but they had that opportunity to come in and spread the virus, and that's what we need to prevent. Additionally, we have a hard time, anyone who works with kids will tell you, you have a hard time not sharing objects with them and not being close to them, especially while you're teaching them. It's very difficult to teach a kid or correct their math when you have to remain 6 feet apart from them. And when you combine that with the fact that the kids are not great about keeping their masks on, it leads to a situation where I personally feel unsafe, and I know many of my colleagues do. What I'd last like to bring up is Rhode Island. You may remember in early December, Rhode Island had one of the largest outbreaks of COVID-19 in the country after the Thanksgiving holiday. And that was driven in part by the demographics and the multi-generational families, the multi-family homes. Having that many people under one roof, you're coming in closer contact with people regularly. We're now taking people from those greater risk situations, sending them to a place where they're coming into contact with even more people, having another chance to spread it, and then bringing that back. In my opinion, it's a recipe for disaster. I'm worried for the community. I'm worried for my students, and I just don't want to see any of their families and their support structures be impacted by this when 2 or 3 weeks remote learning could greatly reduce that risk. That's all I have to say. Thank you very much for your time.
Thank you, Joseph. We wanted Maria Murray to speak next.
Okay, go ahead.
Hi, thank you for this opportunity to speak. So the concerns of the members are really about the holes in the system. We do have contact tracing going on and guidelines that set parameters around who can be in the building and who cannot, but there are some holes in the system that are difficult to close. We depend on the honor system for students and families to report if they've traveled or if they've come in contact with another person or family member that has contracted the virus. I have had students on occasion report travel, like during a sharing time in school, and as soon as that was reported to the nursing staff, they did send that student home. But in the meantime, he was there potentially exposing other students and staff to the virus. So we're depending on that honor system. The other point that I want to make about that is some of the elementary teachers did a typical survey after vacation. How was your holiday? What did you do? Normal elementary kinds of things. And they found out that many of the students had traveled out of state. Many of the students had attended large family gatherings. Of course, once that was reported, those students did go home, but by then it's already too late. They've exposed people. So that is another hole in our system. Another potential area where it's very difficult to control exposure is during transition times. Although we do tell the students many times a day, 6 feet apart, we hold out our arms. Some of the elementary teachers have created things with meter sticks to show how far distance is, but students are little humans and they gravitate to each other like magnets. So keeping students 6 feet apart has been extremely challenging. Also during breakfast and lunch, students are unmasked, obviously, so that they can eat. So there is potential exposure time then, and those times range building to building, but approximately 20 to 25 minutes for those meal times. I also want to point out that we do have consultants working with the district who themselves do not come in the building because for whatever reason, their company has determined that they're not going to come physically. So they attend all meetings virtually like this one. And we get videotaped for educational purposes to share with those consultants, but they themselves will not come in the building. I have one more point that I want to make. I really believe that our school system should be doing its part to support the community's effort to flatten the curve. We've heard that expression over and over and over, and I feel like the school is part of that equation, and we should be doing everything that we can, not just saying, well, it's safe while we're inside school, but doing our part to protect the community as well. Right now in the town of Southbridge, the numbers have grown. We see those daily numbers, 5 a day, 9 a day, 19 a day on Tuesday. Wednesday, 30 more people. Just now, in line at the testing site, there were 7 cars lined up waiting to get tested. So we know the numbers are going up. What are we going to do? Are we waiting for people to get sick? Because the data isn't just numbers. The data is people, real students, real families, real staff. Thank you.
Thank you, Maria. We have one more person, and that's Jessica, and she works at Southbridge Academy as well.
Okay, go ahead.
Hi, good evening. So can everybody hear me okay?
Yes.
Awesome. So something that I wanted to talk about is the fact that we are seeing students having trouble with their developmental level of self-control and impulsivity, causing problems because they're having an impulse to physically touch one another, get closer to each other, whisper, show each other things on their phones. And obviously as staff members, we're redirecting and sometimes having larger consequences for our students. But as a staff population, we're seeing this consistently in most schools all day. These kids just want to be a part of each other's lives and live their lives normally. And because of their developmental level of not being able to control their impulses, they're having a hard time stopping themselves from putting themselves in danger accidentally. You know, a student doesn't stop and think, am I breaking COVID guidelines right now? They just go over and they high five their friend. So we're concerned that, you know, this natural impulsivity that they have is going to cause further problems inside the schools. Because even if these students aren't catching the virus themselves, they can still take it home with them at the end of the day. They're still possibly transferring it to their parents or their grandparents. A large amount of our student population lives in multi-generational or multi-family homes. They have a lot more contact with people outside of the schools that they could be transmitting it to or bringing it into the school from home. And that is definitely a big thing we're concerned about, because we want our students healthy, and I want my coworkers healthy. I don't want to go home worried that a child is sick because they came to school. I think that at the end of the day, the most important thing is that our kids are healthy, that they're alive, and that they don't have to watch their families get sick and die. I definitely think that that's a lot of our biggest concerns. So thank you.
Thank you. Do you have, Jocelyn, is that it? That was your last?
That was my last speaker. Thank you for taking the time to hear us out. Like we said, we're just looking to flatten the curve. We don't want to shut down permanently, just a 3-week period in order for people to stay home and hopefully stop socializing, allow this to kind of simmer us down. We're clearly very high in the red. We would love to go, we'd love to go back down to yellow and even maybe not even in the metric. But at this point, the other question we had is like, what is the purpose of the metric? Because it was, when it first came out, we were told, well, we're going to watch it. If we go into red, we're going to go remote. And then they moved the goalpost. The goalpost has been moved. It did go to yellow, and then it went right back up to the red. And we are just unclear at what point is enough enough.
Okay, so I want to start. Andy, I wonder, before we go to Dr. Villar, I wonder if you can answer a couple of questions for me.
Yeah, Beth.
So I know we've pretty much been holding steady. The last 2 days, we kind of had a little bit of an uptick. We didn't get numbers yet for today. Do you know how many active cases were reported today?
I'm sitting on 32 cases today and 2 probables.
Okay. And what is our most recent percentage for the town itself?
For the, I was actually just looking for that. If you want to go to Dr. Villar, I will get you that right now.
Okay.
Thank you so much, Chief McDonald. What can I get you today?
Hi, can I have a number 1 large size of the Diet Coke?
Can whoever that is,
Number 1 of the Diet Coke.
I guess not. Thank you.
Can you just have them get me a hot tea?
Yeah, I know, right?
I'll
And
take a
apple
flip.
pie. All right, Dr. Villar.
You're muted, Dr. Villar.
Muted. You're still muted. There you
I'll
go.
try it again. Thank you very much. I appreciate the opportunity to be here, but I also want to express my apologies in a sense, because I feel as this meeting is somewhat unnecessary in the fact that we've addressed many of these issues repeatedly. And so I'll try to make my comments a little shorter, but I want to start with, first and foremost, thanking Dr. Farag and Ms. Karen Cheka, Nurse Cheka, who lead our district's work in contact tracing and helping create the plans to reopen schools.
Excuse me, Dr. Villar. Madam Chair, can you have everyone who is not muted mute their phones or mute their computer? I am having a very hard time. Dr. Villar is cutting in and out, and we've got children talking and Coke cans opening.
Yeah. Andrew.
You called me?
Yeah, mute. When you're not going to be talking, mute your mic, please. And everybody else who's on the phone, mute your phone, please. Thank you.
Thanks, Roland.
I think the administrator of this event too has the access to mute, so they can go right in and mute everyone.
Unfortunately, that's Andy, and I'm not sure he knows how to do that.
I can do it. I'm just not sure I can unmute people as I need to. This is my first meeting.
You won't need to, Andy. We can unmute ourselves at that time.
Okay, go ahead.
All right, thank you. As you might know, since the beginning of this pandemic, the outbreak in early March, my deputy superintendent, Dr. Farrick, and I have been working very closely with the town in its response to COVID-19. We're members of the town's Emergency Operations Center. Karen Cheka, our nurse who's been appointed to help lead our medical response to this, probably talks to Andy on a daily basis. And we have constant communication around the status of COVID-19 in town. And I'm glad that we've been able to be good partners with the town on this. Just prior to break, as a matter of fact, the EOC actually unanimously confirmed its support for us remaining open. And I'd also remind this board that it was supportive of us remaining open. And that's because we took a look at the data. You know, I have to say I'm very proud of our teachers. I was at West Street School today. We go to the schools weekly in tours, taking a look at classrooms. Our teachers, our educational assistants, our principals, our custodians, our secretaries, the entire staff at Southbridge Public Schools done yeoman's work in opening schools and delivering education for our children. That's the purpose of our work. That's why we're all here. We're supposed to be educating children. We know that it's best to do it in person. I believe that our teachers, along with first responders like police, fire, EMTs, nurses, doctors, they're the heroes of this pandemic and deserve much more recognition, respect, and gratitude. And I try to make that clear to my staff in my weekly communications to them. I think it's critical to talk today. I respect the opinions, the stories that folks share about their concerns.
I'm sorry, Dr. Villar, let me interrupt for a second. Anyone on this meeting who is not speaking, please mute your phones. Thank you.
Dr. Villar, I'm going to mute everybody, and if you could just unmute yourself afterwards.
Certainly.
Did I succeed?
I think you did. Super. Sorry for that. So what, I respect the opinions that were expressed today. And folks, it's important that we survey opinion. We do it frequently as a district. But I need to point out that putting together questions and asking a group of people what you think about a scenario is not scientific data. And we're in the middle of a pandemic. It's really important that we try to make decisions based on data. We do follow the infection rate here in town, and it has been increased. It's been increasing across the globe and increasing across our state and our country. But when we look at the data that Karen Cheka and Mr. Pelletier worked very carefully to gather, what it tells us is that we are not a place where this virus is spreading. And that's really important. I think Jocelyn asked, what's the measure for when should we close schools? Well, all along it's been, we don't want it to be a source of transmission. We want to be a safe environment where we can educate kids. And that's certainly what our efforts have been. I bring us back to the beginning of school year when we signed an agreement with the Teachers Association on opening schools. We talked about when we might make this decision to close schools. And that decision would be made in consultation with the Board of Health. It would be made in consultation with the Department of Education, and determined based on what's best for our kids. So there's, I think, 3 important things that we have to consider when we look at this. 1, there's no evidence of transmission of COVID-19 in the Southbridge Public Schools. 2, a majority of the Southbridge parents have faith in our school system, are sending their children to school. Over 1,100 children, nearly 1,200 children, are sent to school weekly by their parents in person. We have approximately 700 students who are learning remotely. We also now have evidence well into this pandemic that remote learning is less effective, and there's a growing body of evidence to suggest that it's causing harm to children. So for me, when I look at what the metric is to close school, I have to consider health and safety of everybody in our schools, and that includes our children and their families. You know, our jobs is to educate children. So when we look at no evidence of transmission in school, so based on the data that we have uniformly traced all cases to sources outside of school. How is that? Well, we are very aggressive in contact tracing, and we are very aggressive in quarantining. For example, November 2nd, we had a student who came to school positive. That resulted in 15 staff members at the school that several folks talked about today, which is a special facility, unlike most other of our schools. But 15 staff members had to be quarantined because we determined that there was a violation of our social distancing policies. That required the school to shift to remote. That is a remote instruction for 2 weeks. Out of the 15 staff members who were quarantined, no one tested positive for COVID-19. November 24th, we learned a staff member reported to school sick. That staff member met with 3 other staff members for more than 15 minutes. They were sitting 5 feet, 10 inches apart for 15 minutes. I want to stress 5 feet, 10 inches. Our team went in and measured. And when they determined it was inside our 6-foot rule, those staff members, including the building principal, were placed in quarantine. We're not playing. This is serious. The spread of COVID-19 is accelerated, there's no doubt about it. But the increasing number of cases in Southbridge isn't as a result of the schools. And it's important. We follow the data after Thanksgiving. We take a look, and we're not seeing that relative increase in schools. Are cases up? Yes, cases are up. But again, we're not tracing to our schools. Why? Well, we have 6 feet social distancing as our priority. The state, the World Health Organization, requires 3 feet. Why do we have 6 feet? Well, I've been an educator for more than 25 years. I heard, yeah, kids don't always follow the rules. We know that. This is a safety net. And so all these pieces work together. And so making sure that we have an abundance of caution has proven to work through the first 14 weeks of school, where we've had no transmission in our schools. We mandate mask wearing. I have taken this to task. I have had families who want now to take us, because of special education regulations, to hearings over wearing masks. I refuse to reduce that regulation in our schools. Everybody has to wear a mask. And it's not always easy for some young children who have special needs. It is actually quite easy for our elementary kids. Again, spending many days in our schools, watching kids wear masks is no longer a problem. Mandated hand sanitizer. We have so much hand sanitizer that the fire department had to take out special permits. We bought 650 gallons. It's everywhere. Kids use it regularly. Aggressive quarantining, as I've already talked about. We hired 20 bus monitors who actually get out of the bus, watch who's coming on the bus, make sure kids are seated in the bus, and participate in contact tracing. It's proven to be successful. We sanitize classrooms every night with very expensive equipment that we purchased. We did add air filters to every elementary and older building classroom in the district at a great expense because we wanted to add an extra layer to our protection net. We hired additional nurses' aides for all our buildings to make sure sick kids weren't sitting in classrooms. We have Karen Checka observing and coordinating the entire event. So I think that might be part of the reason why we haven't had transmission. Back to our parents and students. The majority of our parents want our students to be in school. We have over 1,100 attending. Why? Well, the hypothesis to that, because again, without a study, I think the parents must trust the systems that are in place. We're talking about them sending their children to school. I'm a parent of 6 children. One of my children goes to school every day in person. My wife happens to be a 2nd grade teacher who teaches in person every day. So this is very personal to me. I live it on all sides. Our parents rely on schools to help their children every day. They know schools provide students with social interactions with their peers. They know that they get 2 meals a day. They know they get medical care while they're at school. They know they get social emotional support while they're at school, and they get great instruction from our Southbridge teachers. So that might be why 1,100 parents are choosing, because they have a choice and they're choosing to send their kids to school today. They know we send a notice out to every day about any case that we have in this district. When we talk about transparency, we send a notice every day. We post it on social media. We post it on our website. We do copy that to teachers. We're not hiding data. We even reported data from vacation 2 weeks after the fact about cases that occurred. Not because it actually mattered at that point, because it's already too late for that to result in transmission, but so that folks would know, because we know we need to have faith in this system. I know we all have anxiety living in a pandemic. None of us are safe from this. Any one of us, any day, can get sick. That's just the reality. So let's do all we can to do what we need to do for our children and keep our schools safe. Really important to this whole equation. Not only do we know that the schools aren't transmitting the virus, thank goodness these systems do seem to be working because of the redundancy, and that's great. We know parents want their kids to be in school because of all those points I just talked about. What we also have to begin to acknowledge is that remote learning is just less effective. And there's a growing body of evidence that we're harming children when they're not connecting socially inside of schools. I would quote the commissioner's recent statement. Over the fall, we have seen a distressing increase in mental health challenges our students are facing. Based on discussions with the pediatric medical community, research studies, numerous media reports, I am extremely concerned about the increased prevalence of student mental health challenges arising during the pandemic. In an October report, the Centers for Disease Control noted an increase in the proportion of child emergency department visits for mental health related reasons, which has remained elevated through the fall. The report states, compared to 2019, the proportion of mental health related visits for children aged 5 to 11 and 12 to 17 years increased approximately 24% and 31% respectively. That's a significant crisis. We see that, we know that kids need to be in school. We also know students don't progress well academically in remote learning environments. Low-income minority students, which by the way is 75% of the students in Southbridge, have been the hardest hit by the pandemic. Brown and Harvard University researchers saw disparities of low-income students. Through late April, they found that students' progress in math decreased by 1/2 in students of low-income zip codes, 1/3 for middle-income zip codes, and not at all by zip codes of high-income families. So when we look at the impacts that are taken into account, the average student could fall 7 months behind academically. So we know that remote learning is not an ideal circumstance. And given the negative impact that it has on students, and I have to then look at the evidence about why would I shut down schools? Well, to go remote, our data suggests we should expect to see the same infection rate among staff, because all of the staff infections to date have been contact traced outside of school. So closing schools is not a safety measure in that sense, because again, we all exist in society. We all have to go places. We all have to take a risk every day. That, I'm sorry, but that's a reality. Closing our schools, even for a short period of time, will mean that a large number of our students are in a community and no longer in an environment that is highly structured, highly regulated by incredibly hardworking, smart people. If schools were not responsible for the transmission of the virus, or I guess if we were responsible for the transmission of the virus, I guess we would see a great deal of cases occurring after each student's been identified. But what we continuously find is that students who do at some point test positive have already been quarantined because we identified their close contact. I think that's a really important point to note. So at the end of the day, I think the decision before us is, what's the data say? What should we do? As a receiver, I'm placed in kind of an awkward position because I am the school committee, I am the superintendent. And I'm just going to be honest with you, across the nation, superintendents have been able to dodge this decision by deferring to a school committee. I don't have that. So I take this really seriously. I don't want a single staff member to be sick. I don't want kids to get sick. I don't want people to lose their grandparents. Again, I have children, I have family members. So what do I rely on? The data. And after 14 weeks, I feel pretty good about our system. So the decision is the system working? Are we able to continue to educate kids in the way that we know is most effective? Can we meet their needs? Can we meet their families' needs? Or are we going to say, I think we should go remote, no evidence as to what that's actually going to result in, cause harm to 1,200 students and families? Because it is going to cause harm to 1,200 students and their families. That I know.
Oh, so Dr. Villar, what is the positivity rate amongst the schools right now?
So obviously a rolling target. Last time I calculated the percentage of student illness, it was less than 1%. It's actually less than 0.5%, and staff was even less than that.
Okay.
We have not hit 1% as a district ever.
Okay.
I can tell you the numbers. Total cases, currently, by the way, today we had 1 case. So, you know, as we come back from vacation and the worry of that we're going to get slammed, it actually was worse after Thanksgiving so far. Now, I would argue next week would be equally important to monitor, and we'd see. But, you know, total cases in the district's been 84. Now we have almost 1,900 students and we have over 400 staff members. That's a lot of people. We've had, see if we can break this down. Remote learners as a district have represented 27 students. And in school, 39. And 35 of those 39 were already on quarantine when they were diagnosed. So they weren't able to spread in school because they had already been pulled out and quarantined.
Okay. And Andy, did you find those numbers for me?
I do have those numbers. In the last 14 days, we had 1,638 cases test. Of that, 197 positives. Do the math out, and it's a 12% positivity rate. Over the last 3 or 4 reportings, we've been floating from 11% to 13, I'm sorry.
So we're still at an average. We're holding steady across the board.
We are holding steady. Unfortunately, we are holding higher than the state average.
Well, of course, I think a lot of towns are.
Yep.
Nicole? Or
Jocelyn.
Oh, Jocelyn, go ahead.
I just wanted to add one thing. At one point, it looks like we had a 12.56 positivity rate, which placed us as the 14th highest positivity rate for any town or city in the Commonwealth. And one thing to keep in mind, obviously, everything Dr. Villar said is true. We are not disagreeing. He has done so much for us to keep the school safe. We have the sanitizer, we have measurements in place, people are wearing masks, kids are washing hands. We're talking about the gaps. Like, we agree, remote learning isn't the best, but the gaps are where we're stuck. And for instance, if you look at our absentee rates with kids being sick, it's really hard to get a test right now. It's very difficult to go get tested. It's very difficult for our community to afford testing or to even know where to go. If you look at Harrington,
I'm going to stop you right there. We have a community hospital here in town that does have testing available for everyone. This is not, we have test availability. What we don't have is quick testing. You have to wait, and that is the problem. There's a difference. Everyone wants to go and get a rapid test. You can't get a rapid test. You need to get a test, and you need to quarantine for the 3 days till you get your results. That's the issue.
That is also true, but they are booking out for days, like, to get an appointment.
Because everyone wants a test. You can't just walk in and get a test anywhere in this state.
Agreed, and that's part of our point. So people are choosing not to test where they might be positive. So these numbers may not even be accurate, because we know a lot of people won't wait.
These numbers aren't accurate. There are no COVID numbers that are accurate, because the majority of people that have COVID are asymptomatic, and they're not going to get tested, and they're not going to quarantine because they are asymptomatic. So it's completely moot anyway.
And then today we had a student who, like, this is our other thing. We had a student come to school Monday and Tuesday whose family member was told, you need to quarantine, your kids need to quarantine. And those are the other situations that the staff is concerned about.
And so, Karen, what exactly is your process when you find out about cases?
Okay, can you hear me?
Yes.
Okay, so I just want to say that much of the success with our mitigation strategies really has to do with the teachers, the staff, the faculty, the students. Because of the environment that we're in, things get reported so quickly. If a student comes in and there's a question, we get them right away. We have a medical waiting room. We contact the parents. We get them home as soon as possible. We give the parents guidance. We guide them through the whole process. If anybody has been near me in the last, 3 or 4 months, my phone, it just goes nonstop. I'm available always. People can call me with anything. I guide them through testing, quarantine times, all of that. I did want to say too, since you're addressing the gaps, that transmission can happen through contaminated surfaces, but it's really been only shown to be about 6%. So that's very, very low. And most of my training comes from the Boston Children's Hospital. They've really helped the nurses to keep us updated on some of the, current strategies and all of that. So, so the process is, if a student comes in and they're not feeling well, the teacher will send them to the nurse. The nurse will assess the student. We have a checklist of COVID symptoms. If we think that it's that, they go right to the medical waiting room. We separate them. We give them medical masks. They go home for testing. Same with the staff. If they have symptoms, they go to the nurse, call me, and we refer them. Does that help? You're muted.
You're muted, Beth.
Oh, sorry. Roland, my board, do any of you have any questions?
Yeah, I do. I have a question.
Okay, Nicole, go ahead.
For the COVID symptoms, what exactly is on the checklist?
Karen, if you'd like to go through the checklist.
Sure, I'd be happy to. It's fever 100.0 or higher, chills, shaking chills, difficulty breathing or shortness of breath, new loss of taste or smell, sore throat, muscle aches or body aches, nausea, vomiting or diarrhea, cough, which is not due to another cause such as chronic cough, nasal congestion or runny nose, not due to allergies, headache, and fatigue when with other symptoms.
So basically, Karen, that's pretty much the same questions for the contact tracing. That sounds very similar.
What do you mean in terms of
No,
symptoms?
the checklist itself. Those questions are the same kinds of questions that you ask in the contact that we had for the contact tracing.
Yes, they're exactly the same. Yep.
Okay.
I've got another question.
Go ahead.
Karen, wanted to know, so I know a couple of them you were saying the symptoms are, in connection with another symptom. If any child is to present or complain of one particular symptom in itself, is that enough to go further with that? Or no, do you just wait for certain symptoms to be present together?
Well, this is the beauty of having a nurse in every building. The school nurses are trained. They're trained to look for certain symptoms. They conference with the parent. They conference with the physicians. And so it's really a combination of things. Sometimes it's not even any of these symptoms. Sometimes it's something that the nurse picks up while talking to the student that, prompts us to move forward with it.
So if a teacher had just noticed a student was congested, what would be the process of that? They just noticed that the student was congested.
So fortunately, the teachers are very diligent with that. So if they notice it, they would send the student to the school nurse, and the school nurse would do the assessment.
Okay, thank
you. Andy,
Hey.
or not Andy, sorry, Tony.
That's okay. I just want to make sure when Dr. Villar was speaking, I just wanted to make sure I got some of these numbers correct. So Dr. Villar, you said there were 27 students remotely who contracted COVID, and then you said there were 39 that were in school, but of the 39, 35 actually never really made it into school because they were already quarantined?
When they tested positive, they had been prior placed on quarantine, correct?
Okay, all right. I'm just going back to, there was, excuse me, I've been trying to take some notes. So who spoke about, there's some things that seem like Joe brought up, ventilation in the schools. And I've heard you say that we've replaced some filters. Is there any validity in those statements about the systems? I know they're old, but some things I think are easily remedied, but I just wanted to hear more about that.
Sure. So I agree with Joe's statement about the middle school and high school. It is our most modern building. It's built in the last 7 years, and so it does have our best air handling systems. And over the summer, all the filters were replaced and upgraded. And we do have UV light systems at the high school, middle school, and it's set to the highest rates of air exchange possible, so that you have fresh air constantly flowing. The elementary schools, as you mentioned, are much older, as is Cole Ave, which is used as our alternative school, Southbridge Academy. So we've had windows open in those buildings, but as soon as we could, early in the fall, we ordered the air filter systems. They are HEPA filter systems with UV light, and they are designed to, over a period of hours, clean the air in classrooms. So trying to maximize our line of defense in those rooms. Also went through and made sure that all the vents and fans worked in all those older buildings, and continue to stay vigilant with that, because, you know, it could have worked tomorrow. Today it could have worked, and an old fan might not work tomorrow, and so we need to be vigilant about it. And, you know, they continue to do that work. But, you know, and then in that environment so far, our data has held pretty well.
Thank you.
You're welcome.
Andy, quick question.
Please.
Because I know back before the restaurants could open, you had to go through and check the airflow and everything in the buildings. Were the schools included in that as well?
The annual inspection occurred right around the time of the school beginning. I had Mike doing the annual inspections with Steve, Lieutenant Lavoy from the fire department, and the mechanics of the ventilation systems were included in it.
Okay, and all that stuff was checked out, and it all met the guidelines.
As to function, I believe if I remember right, Mike did ask them to deal with some filters in one of the schools, and that was done before the school opened. But the function of the air movers as they exist in the building works.
Okay, thank you. Roland, do you have any questions?
Yeah, just a few. Dr. Villar, I received a copy of the numbers that you gave Councilor Marquetti. And it stated for the entire fall season. Number one, my question is, how often do you come out with updated numbers for the schools? Is it weekly? Is it bi-weekly?
What we do in our communication is every day, if there's a case, we'll communicate that immediately at the close of school. We don't want to do it, you know, at 8 in the morning, but every day we'll send out a communication if there's a positive case. So, you know, it's sometimes daily, sometimes we go without a case. And so that information is regularly shared.
Okay, so basically it's shared when there's a change. You know, that one that I saw was quite in depth. That included bus drivers and everything, which was, I was quite impressed, especially on the small numbers. One thing that I would like to ask you, if we could, is that maybe weekly, if we get a summary sent to the chairman of the Board of Health, so that we can have, I know, I'm going to butcher it, Jocelyn, the first speaker, she was saying a lot of numbers, and I got lost in some of this, and it was unfortunately we didn't get this at the beginning. But we need to get accurate data, and if you could include us, or at least include Beth, so she can filter it down to us, so that we can see the trends. Because I know everybody and their uncle right now is talking about, we haven't even hit the peak for New Year's, because unlike Thanksgiving, which was one day, usually the Christmas / New Year's is usually a multiple day. And I will tell you, I agree that a concern is the gaps. But what I'm seeing out there in the public is the gaps is the human nature of these people that aren't paying attention to the rules. And one thing that I've heard tonight that I am very proud is how everybody here, you have the rules, you're not scared of enforcing the rules, you're not intimidated by the rules, and you're making everybody follow the rules. And that is why the numbers are down. Right now, that's all I have to say.
If I may, thank you. The data that I sent to the councilman was on New Year's Eve, as a matter of fact, and I was able to send him that information upon his request because Nurse Cheka has worked so diligently to maintain a database for us. So it was a matter of a couple questions, and she was able to send it. So we certainly can share that data with the board. Obviously, we will remove the columns that identify the individuals.
Oh, of course.
So that we, maintain that
Absolutely. We don't need,
confidentiality.
we don't need that.
And just to give folks an idea of the granularity of this data, I'm looking at the tracking sheet right now, and I can see a date, the grade, the school, the symptoms the individual had, the symptoms onset date. I can see the close contact number, the quarantine, where they tested, who was positive, who was negative, and what date can they return to school on. And that is, this particular is the tab for teachers and staff. And these data go right now, 234 lines. When I look at the student side of this database, and again, this is kudos to Nurse Check, and I think she's a large reason why this has worked so far. We have 469 lines of data when we talk about contact tracing for students. We take this super serious. This is not something to play around with. And again, I'm very thankful for Nurse Check's effort.
We don't need to get that in depth, but absolutely, Nurse Check is the best. But what she had given or what was forwarded to Councilor Marchetti was, I think, the type of data that we need, and was very enlightening. And I don't think that any more than that would change that 1/3 of a page that was sent to Councilor Marchetti. I think that was fantastic.
Well, we're happy to supply that.
Thank you.
Thank you, Dr. Villar. Yes, you with your hand up.
Hi, me with my hand up. I'm Martina Shea. I'm chairman of the school committee. And I want to thank everybody for all of their input tonight. The one question I have, and it's probably way too soon to ask, is does anybody know how this new variant of the COVID is going to affect children?
So I'm fairly certain that there's probably not anyone on here that would be able to answer that question, because there is not any information available. And Karen, have you heard anything?
I have not. Just from what I'm following is there are, every day different variants, and so we're just following it closely. But no, we don't know right now.
Thank you.
I just trust that you continue to watch this. Thank you.
Madam Chair, I'm on my phone. This is Chairman Jovan of the Town Council. Would you indulge me for a minute?
Sure.
Okay, just for the staff that are on, Chairman John Jovan of the Southbridge Town Council. I also chair the Emergency Operations Center that Dr. Villar had alluded to at the start of this of his presentation. Just want to assure all the members that are out there that the town of Southbridge has taken an aggressive approach when this pandemic started. And I can't say enough about the assistance that the Southbridge School Department has put forward to the town of Southbridge. As part of the group, we have the police chief, the fire chief, acting as our incident commanders. We have the public health, Mr. Pelletier, our town officials, Councilor Adams. We have worked very diligently to make sure that we address every concern that everybody has in the community. And I think on behalf of the town, we have put ourselves in a position where we're well ahead of what other communities have done, both not only in the mitigation of the pandemic. Yes, we do see the numbers going up, but as a town, we continue every day to make sure that we're on top of this. We're probably one of the only communities that have continued to have this emergency operations center ongoing to make sure that we keep on top of what the numbers are and how we may provide assistance to the community. We talk regularly with Dr. Villar, and Dr. Villar has been very transparent in all the communications to us on behalf of the town throughout this pandemic to make sure that all staff and students are safe. We talk about the safety of students, staff, at every meeting, and we communicate as to what our thoughts are in moving forward. And if the numbers changed and we were in a position that we had to pivot to a remote learning, Dr. Villar has put the school in a position that if needed, we would do so. Going forward, we talk about vaccines and vaccinations to the community. Of the 74 towns that are handled by our public health, Department of Public Health, the Southbridge is on the forefront of that. More information will come forward. So again, Dr. Villar, thank you for everything that you do with the school, but I can assure the teachers and the staff that we communicate regularly to make sure that you are all safe, that the students are safe, and that if we have to make a decision, we will do it with the best interests of everyone involved for the safety. So thank you for your time, Madam Chair.
Thanks, Jack. I guess, Jocelyn, I'm not sure what else, if there's anything that hasn't been covered that you think needs to be addressed as far as these two concerns.
I guess we want to know what the metric will be if you decide to go remote, because it's still unclear.
Well, I do believe Dr. Villar said as long as the school is less than 1%, then it's not going to be remote. So what would be an adequate, I mean, they've been maintaining the same percentage, so since school started.
Yes,
So,
according to those numbers that he's using, I agree. But we've discussed the numbers that are not being counted, but moving forward beyond that, it would be nice to have a flat percentage rate. Like, okay, if it starts to rise and we hit 4%, then we're going remote. Like, we want just a clear metric.
Dr. Villar?
Well, again, as we've talked, in the MOU that we signed with the SEA in October, community prevalence is an issue that we would look at and determine close. And we continue to monitor that every week. In the last couple of weeks, we're trending down. We're still in the red. For me, as I expressed earlier, what's most important is, are we causing transmission of the virus to our staff and our students? Because if we are, that would be a great concern, because that's an action that I can control. To date, that hasn't happened. Our rate is well below 1%. I think picking a number is almost arbitrary. We're in a once in a 100-year pandemic. So I don't think we could lean on science as to tell us where that number lies, but it comes down to our best judgment on, are we continuing to maintain a safe environment? I remind folks that these numbers are rolling numbers. So as kids, become positive, other kids have healed and returned and are no longer sick. And same with some of our staff that have been sick. So it's a matter of what's the condition over, in my mind, the next few weeks are critical. And if we can maintain our current status and the numbers, stay within the realm that we've been in, we're in pretty good shape and we can continue our mission. If things are out of control, then obviously I would say I would need to meet with this board again. I would need to meet with the Emergency Operations Center. I would need to meet with the department and discuss what our next best move is. I will stress we are prepared to go remote. That's not the problem. We have purchased 1,800 laptops, 500 Wi-Fi hotspots for families, and our teachers. I can't say enough about the phenomenal instruction that they are doing with kids sitting in front of them on computers, kids at home. They are working so hard. I can't stress that enough. But this demand for a metric, I think it is when conditions aren't progressing, if conditions have deteriorated to a point where we don't have staff and the virus is spreading in school, then I'm alarmed. I'm just pleased after 14 weeks, we have no evidence of the virus spreading in our schools. We should be quite proud of the efforts of our staff, because that's really the response of staff.
Thank you. I see a
Madam
mic.
Chair.
Yes.
I have a question. We've heard from the SCA, we've heard a lot of information, and definitely I agree gaps are a concern, things of that nature. We heard from Dr. Villar as the administrator / school committee in that position. My question out there, is there anybody out there, if you would indulge, Madam Chair, that would like to bring up comments on the impact if the school does go completely remote, impact and/or concerns? I'd like to hear from the other side of the scale if there's anybody out there who wishes, if you would indulge them.
If I may make one point.
Sure.
I did not communicate the existence of this meeting to families. Candidly, I didn't feel I should politicize this meeting. And did not make an open invitation to the parents of our 1,800 children. But I would suspect that if we, I'm sorry?
That I appreciate that.
I do suspect if we had 1,200 students or 1,100 whatever students that are attending school every week, parents here, quite a few of them have a lot to say about if I close schools, for example, starting Monday. They have to find childcare. They may not be able to work. They have to find not only childcare, but someone's going to help their kid learn remotely for several weeks. Which I can tell you, my wife and I are educators, and when my child last spring, when the whole world decided we're going to shut down, he was learning remotely, and my teenagers were learning remotely. We're pulling our hairs out, and we have degrees in education. So, God bless the 1,100 kids' families if I tell them next week we're shut down.
Andy?
I just have one question to Dr. Villar or Margot. If the schools go remote, a student learning remote at home, how is it a controlled 6-hour day as it is if they go to school? Or is it however long it takes to get the lesson done and then the kid can go and do what the kid wants to do?
So good question, thank you. And so there's two learning models that exist. Synchronous is what you just described, where they learn all at the same time. Basically, you recreate class digitally. And that is the model that we have in place in the vast majority of our schools. The middle school actually uses a quasi-synchronous. They also have independent learning, asynchronous, through a online platform that they use. The State Department and the State Board of Education just released new guidance and new policies because they're concerned that some districts have gone too asynchronous because students are not getting any interaction with adults. So our model would continue to be synchronous wherever possible. That means kids would be required to log in and participate in instruction with their teacher who's remote, for hours in the day. It's the majority of the day.
Okay, thank you. Was that it, Andy? You didn't have anything else?
No, I only asked the question because I wanted to, in my mind, know if we did go remote, would we be giving the kids more freedom to hang around together? But apparently it's a very strict remote and it would be as controlled as having them in the school.
Well, I will say that there's, many discussions have occurred among teachers about how to deal with students learning remotely who may not be logging in on time or focused or have distractions. Or again, this is why the data, I believe, is beginning to reveal that remote learning is not a good idea. Hard to structure a home environment that works for remote learning. Particularly at our secondary schools, we are not seeing as high levels of engagement remotely with students. And we've, in fact, at the high school months ago, invited back more kids, said, hey, come to school more, because they weren't doing well remotely at all.
Roland?
If that's all we have, I'd make a motion to move the question. Or move the discussion.
Okay. Nicole, Tony?
I'll second that motion.
Okay.
I'm sorry, I didn't hear what Roland said. I'm sorry.
So I made a motion, Nicole, to move the discussion and go to a vote.
And Tony seconded.
Okay. I just wanted to make a point here. I do have some concerns, mainly because, as we all said, it's that, the COVID numbers, they aren't going to be ever accurate because there are a lot of asymptomatic. So it's kind of difficult to do that. And just seeing how there's 30 today, and just pointing out how we had a recent spike in deaths. We've had 8 since November. And I just want to point that out. So other than that, yep, I agree to move to discussion.
Is there any more time for questions?
I can allow you one. Go ahead.
Okay, my name is Anthony O'Coin. I work for Eastwood Road School and worked here for about 13 years. And I just have a quick question. Thank you so much for the opportunity to speak. And my first part of my question is, whose decision is it to go remote? I feel like Dr. Villar has way too much responsibility when it comes to making this decision. I thought the Board of Health would play a bigger role.
So the school works in conjunction with the town and the Board of Health, and we make recommendations. But ultimately, it is the school's decision as well, but we do have a say.
Okay, thank you. We've been trying to, I know we talk a lot about the students' mental health, but teachers are having an awful difficult time with this, going home every day. And so anyways, in-school transmission percentage, I really, and I speak on behalf of a lot of teachers in the district, I want to know what percentage are we looking at? And I think you guys need to come up with a percentage because, we need to know what percentage of in-school transmission will warrant remote learning.
You do realize that it's an arbitrary number. These are all arbitrary. Oh.
Nicole, can you mute? Because there's
mute?
a little feedback.
Anything else? I mean, do you want to add to that, Dr. Villar?
Oh, just again, I appreciate the collaboration with the town, the Board of Health, with the town council and the EOC for sure. And it is a daunting decision no matter what. But again, as I stated earlier, I do think affixing a percentage to it is arbitrary. But more importantly, we're monitoring the data. We're looking to be sure we're not responsible for transmission. We want to make sure we can continue to have a safe environment. The one time we did shift a school to remote was because we could not maintain a safe environment. So that's evidence that if necessary, I'm going to do it. It's just, it has to be necessary. I simply feel way too responsible for the well-being of 1,800 children and 400 adults to make that decision willy-nilly, that's for sure. So that's why we pay such careful attention to this data.
I mean, we get information every single day with the town numbers. We've been monitoring this for months. And I know for myself, Mr. LaRochelle and I both worked a short time and were working on some contact tracing, and the families that we encountered that had school-age children, they were already quarantined before we even got to them. So I believe in Karen's system that she has in place. I think it's phenomenal. I think she is doing a great job making sure that, you know, everything is caught in a timely fashion and that everything is followed up, you know, exponentially. I have complete faith in Dr. Villar and his staff that they're doing everything possible to make sure that the kids are safe. Roland?
Yeah, and I want to kind of echo the same thing. In my past job and in my present job, and the COVID has hit my family very, very hard, and I have to keep emotions out of it. I do not envy the teachers, neither do I envy my brother firefighters. The other challenge that I've seen through over 30 years of public service is that the school has been a safe haven for these children. And I will tell you right now, if the numbers rise, that the school is a source, I will be the first one to get up on the bandwagon to say close the doors. I have, through the contact tracing and things that I've seen, the kids in school are not walking the hallways of Walmart. I have been seeing grown adults blatantly violate mask rules and everything, where all of you teachers and everything are keeping these children to task. I have a very, very difficult time with this. I hate to take the safe haven away from the children. And at this point in time, I would like to take this as a vote, if you want to, Madam Chair.
Actually, I see Gus had his hand up, and I think he wanted to add something as well. So, Gus?
Madam Chairman, I did have one quick question, one observation. One is that through you to Dr. Villar, I know some towns have joined the Binox Now testing program, which is rapid testing. Somebody earlier mentioned the lack of rapid testing. Is Southbridge part of that program, or is there any opportunity for Southbridge to join it? And I honestly don't know how effective it is, but.
We are part. Karen has used a test. I know that we're in the beginning stages to have that capacity, but yes.
Okay. Do you know how many tests Southbridge is likely to be getting, and how any evidence as far as how effective it is or how accurate it is?
I would definitely defer to Karen to answer those questions.
Yeah, so I can answer that. We did get a limited amount of testing. We're just rolling it out right now. The way this whole Binax testing began was they did a study at Lawrence General Hospital, and I hope I can get the numbers right off the top of my head, but the test showed to be 97% accurate for the age under 18 and 79% accurate for the adults. So don't quote me on that. I have to look it up, but it's I believe that's what it is.
It's weird that there would be that disparity, but that's interesting. Okay, well, thank you very much. And the other observation is just actually just more for the board itself. You had a motion to move the discussion, but you don't actually have a motion on the floor.
Yeah, I know. I just.
What are you voting on?
Roland? Well, Roland didn't get that far, so.
No, I didn't get that far. I have a question for Karen regarding that rapid test. Karen, those numbers, I did reading on the original, not particularly the one that you're talking about, but rapid test before. When the first 5-10 minute test came out, there was a very large percentage that they were rated accurate for a positive, but they did not fare too well on a negative response. Did the numbers for this test break it down on accuracy?
I'm sure it did. I don't have those numbers in front of me right now, but
Okay.
one thing I can say is that it's a very, very sensitive test, and it has to be very precise. One error will shove everything off. So I think that's where all the variables would come in.
All right, thank you.
Tony, you wanted?
Yeah, I just wanted to make a comment. I have a fourth grader in town. So I just wanted to say I have nothing but the utmost respect to the teachers in town. I know their positions are very, very tough. And it seems like they're fighting a battle that really the school committee, and it's an uphill fight, because a lot of what I'm hearing tonight has to do with people outside of school and their behaviors. So I want that to be recognized, that I understand this is a huge challenge. So I appreciate the work they do. And like I said, I have a fourth grader in town too. So not only do I look at the teachers to educate my son and make him the person he's going to be in the future, but to keep him safe. So this isn't a very important matter to me. That's all I'd like to say.
Okay, Andy, I think I saw you with your hand up earlier.
I was actually going to weigh in on Gus's comments about the testing. I've been working with Karen she's been working very diligently to get it into the schools. Once it becomes medical waste and stuff, I've been working towards finding her a means to get it out. We're working together to make this and bring it into the schools. So that was the other comment, but Karen more than covered it.
Okay. Nicole, Tony, Roland, anything else?
No, I just, like I said, I just feel that because of, many who are asymptomatic, I mean, that's really the danger with that. And as the other teachers were speaking, there do seem to be holes in that. And that is the concern. So I just want to basically put that out there.
All right.
Madam Chair, a
Yes.
question on housekeeping. The way this agenda is written, is this one vote for number 1 and 2? Because this is not, is this agenda 3.1 and then 3.2, or is this one vote for both? Because it's, well, I'll stop there.
Andy?
The chair of the board can take it in either direction that she wants to. My recommendation would be that we treat each petition or each request separately. Take a motion on the first one and resolve the first one, then take a motion on the second and resolve that one.
Okay.
All right, in that case, I will make a motion pertaining to agenda 3, number 1, that at this point in time, the Southbridge Board of Health takes no action and watches the numbers and reserves the right to call this back to the table at any point it sees fit.
Do we have a second?
I'll second that.
Okay. All those in favor, roll count. Andy, you know you're on mute, right?
Nicole Duffy,
No.
Tony Postali.
We take no action.
That is the motion is to take no action, but to monitor the data and reopen as the board deems necessary.
So honestly, I don't know how to, I say we
yes-
take no action.
A
So
yes vote, a yes vote would be we take no action at this time. A no vote would be that we make the recommendation to the school.
I'm saying yes.
Roland LaRochelle,
Yes.
Elizabeth Stevens.
Yes. I know,
Vote
Tony, it
passes.
gets confusing when he does it that way.
Right, Roland, did you read the question?
Sorry.
Go to the Board of Health 3-1 to take no action at this time, but to follow the data and reopen as the board deems necessary.
Agreed.
And I'd like to make an amendment to number 2. That the school administration supply the chair of the Board of Health with a report at least weekly.
I would suggest that be a request on the side. This is and obviously the board has jurisdiction over me, but this is a petition by SEA. And
Point of order, Madam Chair. This is a Board of Health agenda. I put a motion to amend number 2 on the table. This is our agenda. We're entertaining what the SEA put forward. I want the Board of Health included in the SEA's reporting or the request for reporting. And that's why I made that amendment. So I would like to see if the board would entertain a motion on my amendment.
Do I have a second?
I second that. I second.
Okay, so
And Dr. Villar said he would do that too. Didn't you, Doctor?
Yeah, we have no problem sharing that information.
I think Roland's point is just making sure that we actually get that information, because sometimes
It's
we
just
don't
a,
seem- not
it's
necessarily
just a
follow.
housekeeping. It's just a housekeeping issue.
Andy,
I need the wording. I recommend the Southbridge administration offer transparent and uniform reporting on COVID-19 cases. You want that amended? I need the wording. Because I'm not sure how to word it to include.
To include a report to the chair of the Board of Health, minimum on a weekly basis.
yeah, that's it.
Okay.
Okay, vote.
We have a second?
We did, Nicole.
Yeah, I second it.
Okay. I'm just writing this, I'm sorry. Okay, so we have a motion on the table to recommend that the Southbridge School Administration offer transparent and uniform reporting on COVID-19 cases to include a report to the chair of the Board of Health on a weekly basis.
Andy, parliamentary rules right now, that is, if accepted, the final vote. I brought up an amendment, and the only verbiage in my amendment was to add.
I just lost my internet. Can you repeat that? I'm on the phone now.
I said, you recorded the entire second part of the agenda with my amendment that has not been voted on yet. What we are talking about now is simply the verbiage of an amendment to add that the school administration will forward a report to the chair of the Board of Health weekly.
Okay.
That's all we're talking about now is the amendment.
Okay.
Do we have a vote?
Okay, Nicole Duffy,
Yes.
Tony Postali,
Yes.
Roland LaRochelle,
Yes.
Beth Stevens.
Yes.
Thank you.
All right.
Now we'll make a motion to
Right. So we have,
recommend as
That was
number
just
two.
for the amendment, Andy.
Okay.
It was
That was
just
the
for
amendment, Andy. This
So I'm
motion I'm
reading-
going to make,
reading the whole thing with the amendment.
that is
To
my
recommend that
motion
the
right
Southbridge
now.
School
is
Administration
to-
offer transparent and uniform reporting on COVID-19. Excuse me?
With my amendment.
My internet keeps cutting out.
I'm sorry, my internet.
Okay, so we still have a petition on the table that you amended.
Yes, if you give us a second, Andy. Okay,
Yep.
I am making a motion to accept item number 2 as written, including my amendment.
Okay.
Do we have a second?
Madam Chairman, just as a point of order, you already had a second. So what you're going to vote on is the main motion as amended by Mr. LaRochelle.
Yeah, I know. Because Andy just,
So you already had a first and a second. So now you're just voting on the motion as amended. So you already had the second.
Andy, just the vote, please.
No, can we speak to that item first?
No, I know, Jack.
No, I just want to state that the school district has provided transparent data. So
I'm well aware of
that motion, I would say, to add continue to provide transparent, not to provide, to continue to provide it, because they have provided that information.
I
just wanna
realize
ask, 'cause this motion is going to be recorded somewhere in the annals of time that the school district didn't provide information. They did provide information. They have provided information. You're just asking them to continue it with the proviso that you guys get additional information. Thank you for the indulgence.
Andy, do you have that?
Yes, it's recorded. Nicole Duffy,
Yes.
Anthony Postali,
Yes.
Roland LaRochelle,
Yes.
Elizabeth Stevens.
Yes.
Thank you.
All right. So with that said, I want to thank everyone for coming. I hope that people's concerns have been addressed. And as I said before, we continue to monitor everything on a daily and weekly basis. And I want to thank Dr. Villar for the additional information, and Jocelyn and the school committee, or the teachers union, sorry. Hopefully that, this addresses some of your concerns. And if anything should change, we will be back here to adjust our findings. Do we have a motion to adjourn?
So move.
Second?
Second.
Okay, all those in favor? Vote please.
Nicole Duffy to adjourn.
Yes.
Tony Postal to adjourn.
Yes.
Roland LaRochelle,
Yes.
Elizabeth Stevens.
Yes.
Thank you.
All right, 6:44.
Thank you all very much.
Thank you.
Thank you, Dr. Villar.
Have a
Thank
good
you.
night.
And thanks to the SEA.
Thank you very
Yes.
much.
Yes.
No, and thank you to all the teachers and staff for keeping the count low.
Thank you,
Absolutely.
everyone.
Thank you.